Thank you very much, Don, and I'd also like to acknowledge the traditional custodians of the land that we meet on, the Gadigal people of the Eora Nation, and I'd like to pay my respects to the elders past and present. I'd also like to thank all of our study partners and study participants, and I'd also like to thank all of the researchers who are using the data, because without that potent combination, we wouldn't have anything, and I wouldn't be standing in front of you now. So I'm here to do something which has become a ritual. I think this is possibly the 13th or 14th time that I have done this, and it gives me such enormous pleasure because it's a marker. It's a marker of the progress that we've made. So every year I get to review all the research that's happened, all the progress that we've had, and it's really such an amazing time for me. I know that when Sally said we sort of had this general idea for the study, wrote a protocol, this is a great way to do it, got some partners. I really would not have imagined we'd be where we are now, and so it's a fantastic occasion for me, and I'd like to thank everyone who has made the achievements of the study and the research we've produced possible. So I'm going to give a brief background, talk about study progress. I only have 10 minutes. I'm going to talk about some highlights and priorities going forward. Now, for those of you who don't know, the 45 and Up study is the largest long-term study of ageing in Australia, and it is a collaborative resource and receive core funding from our study partners, as well as a depth of engagement to address problems that matter to all of us. Participants were recruited through the Medicare Australia enrolment database, and they completed a detailed questionnaire about their health at baseline in 2006 to 2008, and they have completed follow-up questionnaires. They've consented to following their health over time, including through both data linkage and also through being contacted again for routine questionnaires, but also for detailed studies. This is the baseline recruitment, and you can see shading in each area according to the number of participants in each group. We have around 250,000 participants, and that's around 1 in 10 people in the age group 45 and over in New South Wales have actually completed a questionnaire for the study. So it's not just that it's a large number of people, it's a really big, it's a kind of window into the population that lets us really be able to follow what's happening at a population level. We oversampled in rural and remote areas, so we have around 50% of participants are from non-urban areas and 50% are from urban areas. So this is the study design, which is actually what was sort of drawn in the protocol, which was written in late 2003. So I still marvel at the fact that it actually looks the same, it looks like what it said on the packet. So we started recruitment at wave 1. We had this study of in economic and environmental factors on health in 2010, which actually followed up a substantial proportion of the people. We've completed wave 2, and we're about to go to the field with wave 3. We also have a number of detailed resurveys, which we call sub-studies, and I'll talk a bit about them later. And we have a really wide array of data linkage, which is yielding enormous population level data. The study cohort, this just gives you a sort of graphic about the number of people who have responded over time. And we can see that actually we've had very, very few people withdraw from the study over time. So people do have the capacity to withdraw from the study entirely and have their records deleted from that point onwards, or they can say they want no further contact. But what we found is, in fact, very, very few people choose that option, and that we do have, we've had, particularly in terms of data linkage, we've been able to follow people substantively. In terms of the follow-up questionnaires, we have around at least 60% response rates to that, and we're able to match that up against data that we get from linkage. So we have a robust framework to follow people over time. We've also added into the questionnaires since 2014 what we would call targeted questions, and this is where a policy agency or other agency can actually sponsor a quarter of a page of questions that are of particular interest to their policy needs. And those are sent to at least 50,000 participants, and we've been circulating the first reports to policy agencies about that. You can see these questions cover a very wide range of topics, and they've really enriched the study because anybody can, all of the researchers can use those questions, not just the policy agencies. So we've had Defence Force Service, which is of interest to the Department of Veterans Affairs, life experiences including family violence, adverse health events, plans for retirement, and work on caregiving for dementia, motor impairment. So a very wide range, and it's added to the diversity of what's included in the questionnaires. So from the point of view of researchers, we have quite a number of resources on the web, and we love to have feedback from you about any ways in which that can be improved. In particular, we have data books which give you the baseline data, but also data dictionaries that give you more information about the linkages. Most of the linkages through the Centre for Health Record Linkage, so a lot of the data dictionaries are contained there, but we do have information about the pharmaceutical benefits scheme and the Medicare benefits schedule data for those linking to those data sets. And there's a big long list of the routinely collected data. We've actually had around 36,000 deaths in the cohort. Now obviously that's a lot, and it is a bit ghoulish of epidemiologists to sit and wait for those sorts of things to happen. But it does mean that those experiences are counted for those people in a way that they wouldn't otherwise be. That we know the factors leading up to their death, we know the factors related to death, and we can compare those to people who live longer. So it is a really important part of the study that we are able to follow those people up. It's also our responsibility to use the information that the participants have given us responsibly and constructively. We're now in the territory where it's actually a data management issue, that we have more than 60 million records for MBS and more than 50 for PBS, and large numbers, 2.1 million hospital separations, so very rich data that are available. In terms of the sub-studies, I won't go through the ones that I spoke about last year, but just to say that there are a very wide range of sub-studies, and this is where researchers have used the 45-mark study framework to go into greater detail and ask questions of participants that are more specific to their needs. And a lot of these have been bearing fruit. The more recent ones here are a really large initiative on dementia called Maintain Your Brain, also information on cancer progression, and then information about pertussis and self-care strategy. So you can see that this is using the 45-mark study structure and framework to get into additional details. And if anyone is considering a sub-study, then please contact the coordinating centre as early as possible in the process, so that we can really work with you to make sure it's dovetailed into the existing structure as well as possible. So here's Sally Redmond did steal a bit of the thunder here, but I think it'll just serve to reinforce the achievements here. We now have 242 peer-reviewed papers, and I would say that we're now averaging a paper every fortnight or every week, if not every week. So I've just come from talking to the media, and they've said, so what are the achievements? I'm thinking 240 studies, how do I summarise that? So I think it's great if people are available to talk to the media about their findings. There's a lot of interest in those, and it's also a way of actually capturing and showcasing what is really becoming quite difficult to summarise. We've had 58 grants awarded, and I think we've had some more recent ones that we'll be able to add on next time. So I think there's been possibly another 7 million, is that right, Alison? Yeah, up to 7 million that we will. There's only just been some announcements. We have over 650 researchers across 75 organisations using the data, and we have around 140 projects that have or are currently being conducted. So if anyone's thinking of doing something, then you are definitely in good company, and we're really keen to see the resource used as much as possible. We're particularly pleased that 28 policy agencies and over 60 early career researchers are using the data, because a resource like this makes the difference between a small-scale study for training and for early career research purposes, and something that has a large international reach. This is the growth in the use of the data. So the bar graph is the number of publications, and the line graph is the cumulative funding. So you can see that we are still quite steadily increasing. And then I would really encourage you to look at the publication list that we have there. And also, you do need to let us know if you have publications. Obviously, any paper that you're doing 45 needs to have technical review. But also, we need to know good news stories. We need to know that what your research is getting out there. So, additional general highlights since the last meeting. We've delivered samples to the Genome Reference Bank. That's the Medical Genome Reference Bank, which can be used for multiple large-scale studies as a resource. We're also working with local health districts to enrich the data, particularly looking at culturally and linguistically diverse groups. Wave 3 of the questionnaire is imminent, and we do have plans underway to collect 50,000 blood samples to really take the 45 and up study from that framework, which has really high quality data on exposures and health outcomes, to add the genetic dimension, but also the dimension that's given by the analytes that we find in blood. So it's really maximising the probability that we can be using those multiple technologies to improve health into the future. In terms of research highlights, I just love reading the list of publications. Thank you everybody for all of your hard work. There have been major growth in work on cancer and cardiovascular disease, and particularly health services research. So I've just been marvelling at the fact that we've gone from sort of Clostridium difficile to the costs of cancer, to vegetarian diet and all-cause mortality, and compliance with telephone triage when it comes to advice over the phone of whether people are following it. So I can also say that 45 and up data has been used as a background to the 2017 tobacco excise amendment, so that's a really terrific outcome and just one example of many. In terms of priorities, a big priority for us is obviously our continuing partnerships with the agencies that support the work, but also with policy agencies seeking to use the data. And we're particularly keen to see, as much as possible, data from the 45 and up study being used to inform policy and practice. And integration of care is a really big priority across those. We are looking at cohort replenishment through this sort of modular system of recruitment. We're actually recruiting in multiple areas, and obviously the focus on biospecimens and genomics. So I'm going to finish there, concluding with my thanks to all of you for